Miconazole 7 Cream with Applicator is used to treat vaginal yeast infections. It reduces vaginal burning, itching, and discharge that may occur with this condition. This medication is an azole antifungal, which works by stopping the growth of yeast that causes the infection. It comes in two forms, a vaginal cream or tablet, and some products also come with a skin cream to be applied to the area around the outside of the vagina. It's important to ask your doctor before using this medication for self-treatment if this is your first vaginal infection. This medication only works for vaginal fungal infections, so if you have different symptoms, like fever, chills, or a bad-smelling vaginal discharge, you should contact your doctor right away, as it may be a sign of a more serious infection. If you are using this product to treat yourself, be sure to read all the directions on the package before using it. If you have any questions, talk to your pharmacist. If your doctor has prescribed this medication for you, use it as directed. This product is meant to be used only in the vagina. Be sure to wash your hands before and after using it, and avoid getting the cream in your eyes. If it gets in your eyes, wash them with plenty of water and call your doctor if your eyes are irritated. The dosage will depend on your medical condition and how you respond to the treatment. Use the medication once daily at bedtime for 1 to 7 nights, as directed by your doctor. If you are using the single-dose tablet, you can use it during the day or at bedtime. If you are using the vaginal cream, follow the package instructions on how to fill and use the applicator. Lie on your back with your knees toward your chest, and insert the filled applicator into the vagina as far as it will comfortably go, then slowly press the plunger to apply the cream. If you have itching or burning around the outside of the vagina, apply the skin cream to that area twice a day for no more than 7 days. If you are using a product with only the vaginal cream, you may apply a small amount to the area. Continue to use this medication every day for the full time prescribed, even if your symptoms go away or if your period starts. Stopping the medication too soon may cause the yeast infection to come back. Do not use tampons, douches, spermicides, or other vaginal products while using this medication. You can use unscented sanitary napkins during your period or to protect your clothing from any leakage. Tell your doctor if your condition does not improve after 3 days or lasts more than 7 days. Also, tell your doctor if the infection comes back within 2 months. You may need a different or additional medication to treat your condition. If you experience headache, vaginal/urethral burning/itching/pain, or lower abdominal cramps while using Miconazole 7 Cream with Applicator, contact your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Serious allergic reactions to this drug are rare, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. If you are in the US, call your doctor for medical advice about side effects, or report them to the FDA. In Canada, call your doctor or report side effects to Health Canada. Before using this medication, make sure to let your doctor or pharmacist know if you are allergic to it or to other azole antifungal agents, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have diabetes, immune system problems, or frequent vaginal yeast infections, talk to your doctor or pharmacist before using this medication. Also, let your doctor or dentist know about all the products you use before having surgery. Ask your doctor whether you can have sexual intercourse while using this product. It may weaken rubber products and lead to failure, so make sure to use other forms of barrier protection during this time. If you are pregnant, do not use this medication for self-treatment. Use it only when clearly needed and follow your doctor's instructions on how to use the applicator. It is also important to consult your doctor before breastfeeding while using this medication. It's important to be aware that Miconazole 7 Cream with Applicator may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is not a comprehensive list of possible drug interactions, so it's important to keep a record of all the products you use and share it with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. One specific product that may interact with Miconazole 7 Cream with Applicator is warfarin. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or having trouble breathing, call 911. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important not to share this medication with others. To help prevent vaginal yeast infections, make sure to dry the genital area thoroughly after showering, bathing, or swimming. Also, try to avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. It's best to wear cotton underwear and change it daily. If your sexual partner experiences symptoms, they should contact their doctor right away. If you forget to use the medication at the scheduled time, you can use it as soon as you remember. However, if it's almost time for your next dose, then it's best to skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. Remember to store Miconazole 7 cream with applicator at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.